Varsågod. Tack så mycket. Good. Thank you so much. Christopher Cook is my name, CEO of Carbiotix, at least until this Friday, where at the AGM I'll come in as the chairman of the board. So this is my last official presentation as CEO of the company, having started the company back in 2014. But the company itself is focused on microbiome healthcare through a concept we call smart prebiotics. But before I get into that, obviously I'm here for a reason, and we have an ongoing rights issue that wraps up this Friday. So the 2nd of June, we'll be raising 12 million Swedish crowns in total, as well as a technical option. If fully exercised at the top range, will bring an additional 15 million, providing liquidity for fiscal 2023 and 2024. Now, this entire rights issue is 100% secured. And I myself am going in with about 2.5 million crowns, so 20% of the total rights issue. But I'll connect back to this at the end of the presentation, and I think some of our questions will probably touch upon this as well. So the company itself is focusing, as I said, on microbiome healthcare. We're doing this in what I consider a unique way. We're focusing on prebiotics, and I'll explain what prebiotics are, as well as diagnostics. The company is a spin-off company from the Department of Biotechnology from 2014, and we're currently operating 3 development labs in Lund, so we're based in Ideon Research Park. And we currently have a pilot facility as well, which is worth its weight in gold when it comes to being a biotech company. And that has a production capacity of about 10 tons per year. And we're currently 10 employees. We fluctuate a bit, but we're around 10 employees. So what is this microbiome? There have been previous companies obviously presenting in the general area, and it's obviously the bacteria, the viruses, and the fungi that are living on us. We're almost more microbiome than we are human in many cases. And why is it relevant? Well, we know as infants we're born with quite a diversity and number of probiotic bacteria. And as we go through life, the number and the diversity decreases, especially as we enter a disease state. We know that the microbiome has a significant bearing on many different things. Blood sugar, cholesterol regulation, mineral absorption, what we take out of food, and the risk of developing many different chronic and metabolic diseases. And this is an area we're definitely hitting on in the company. We also know that 70% of this gut-associated lymphoid tissue resides in the microbiome. So 70% of your immune system is connected to your gut. Well, we also know our prebiotics are food for these probiotic bacteria, right? They're living off of these indigestible carbohydrates. We know that 90% of adults today are lacking about 50 to 80% of these prebiotics, and that's because we're skewed in our diets. We're eating too much sugar and red meats, emulsifiers, alcohol, and not as many fruits and vegetables, unfortunately. But the benefits of prebiotics are multifold. In addition to the list I showed, this is an area we're really aiming at right now, and that's the pharmacokinetics of consuming more prebiotics. What do we know? And why is this interesting? Well, if we look at the total pharmaceutical industry, an industry that's worth about $1.5 trillion US, 70% of drugs are oral or topical in nature. And we know that if we can improve the efficacy of these drugs, i.e. the amount of active ingredient going through the mucosal layer, reaching the liver, or on a topical basis, then you can have a significant impact on the efficacy of drugs in development, at market, etc. Unfortunately, the amount of prebiotics at market and the ones that are available have tolerance and efficacy issues, and that's the opportunity that we have. So what have we done? We've developed what we consider is a second-generation prebiotic that's up to 10 times more effective. And we're deriving this from the bran, so hemicellulose portion of different cereals. So, for example, oats, wheat, corn, as well as peas. And the intention is to sell this for nutraceutical and cosmetic applications. Again, this is a high-end application we're aiming at, not a food and beverage ingredient, because we're targeting, obviously, the potential health benefits. And actually customizing these particular products to be used alone, blended with different products, such as probiotics, to form symbiotics, and to be used in conjunction with medical foods and therapeutics to address this, which I mentioned earlier, the pharmacokinetics, how much active ingredient reaches the liver. We also have a test to validate this. And again, we're not only working on the modulator, but also on the ability to validate, to personalize, to make sure that a product you're consuming is actually having a positive effect. In this case, in terms of the upregulation of what we call short-chain fatty acids, which lead to the upregulation on the human biomarker side. And today we offer the lowest cost, most flexible and reliable gut health test globally. And this is an additional service. We're moving towards probably a gross margin zero business, and eventually we'll bake this in, and this will be an extension of our core modulator business. The ability for our customers to show to their customers that their products are working. So we're exclusively a B2B company, and we're going to be selling this Carbiotix prebiotic to nutraceutical cosmetic companies as well as therapeutics companies. And it'll be priced at a premium. Again, this is due to the complex structure and our ability to customize the products for different disease areas. For example, if we take we're running a study right now, for example, using our product with metformin for type 2 diabetes patients. We can profile that patient group, see what bacteria are there or not there, and then develop products, customized prebiotics or symbiotics to target that particular patient group to elevate the potential impact or efficacy of the drug they're taking, in this case metformin, which is an off-patent drug. LinkGut today is sold as obviously a B2B service to different companies, and we'll continue with that because LinkGut and the Carbiotix product together make up this smart prebiotic concept. So how big is the market? We've segmented the market to what we consider the ingredients market for nutraceuticals. And there we have a TAM, or a total addressable market, of about 1 billion euros today. Our goal is to target a higher end application and thus a higher margin in our particular product. And then it's broken down into different markets. So we're aiming to get grass right now, and that market is about 350 million. We think, however, we can get a multiplier effect on our total addressable market by looking at other applications. The combining of the prebiotics and the probiotics, we think, can actually 5x the total addressable market, creating these symbiotics. And we recently came out with communication of a development partnership with one of the top 10 probiotics companies globally to develop these symbiotics. The consumer microbiome testing market is a smaller market, about 100 million TAM today. But if we get into clinical and research applications, we think that we can 10x this. But again, this is there to support, to validate the efficacy, to personalize these products for different individuals. Key persons in the company. I was the CEO of the company, or I still am, at least until this Friday. The idea is that I'm moving over to chairman of the company, and then the CEO will move into the position of CEO in the company. We have 2 individuals in the board who will be departing, and 2 new members coming in, Gia and Jürgen. My intention with the new board is to really gear up for a ramp up in terms of B&D, so business development and sales activities targeting 4 core groups. So probiotics companies, prebiotics companies, cosmetics companies, and pharma companies. So you're going to see a big ramp up when it comes to targeting those companies and really building up relationships and getting these customization projects in the pipeline as well. In terms of the current rights issue, the proceeds will be used for different things. About 65% for Carbiotix, which is the core prebiotic product. 25% for LinkGut related activities to close up this smart prebiotic concept, and 10% for obviously the rent of our research labs and our production facilities. But in terms of the different areas, we're currently upgrading our production site in Bjuv, so that's outside of Helsingborg, with different technologies to allow us to produce more refined products and based upon different substrates. The idea is to start these development projects with many different companies, provide samples, and get that entire pipeline going as well. Getting the regs in place is critical for us. Obviously, GRAS in the United States is a process that has taken time, but we've used this time very efficiently as well. to develop a second-generation process which allows us to more than double our yields from our process. And the idea is we want to hit both applications, nutraceutical and cosmetic, so epidermal applications at the same time, as well as start work with our European regs as well. We have a current study, a metformin study, where we're using our product, Carbiotix, with metformin, and that study will be completed hopefully by mid-year, and the idea is that we submit an application for about 25 million Swedish crowns in financing to do an extended study. So from 50 to 100 patients up to 500 patients is the idea there. And there we'll be bringing in key actors, so in the pharma industry and in the supply chain as well, is the idea. The last part, obviously, the symbiotic product. As I said, we have this collaboration with a probiotics company, and we'll be continuing the push with similar projects as well with different companies. Now, the unique thing about our approach, as I mentioned earlier, is the fact that we have these customized projects and the fact that we're targeting these different indication or disease areas. The benefit for us is that this is a food and beverage ingredient. So it's a nutraceutical targeting a disease area to be used as a co-intervention. So we don't have to go through all these clinical studies. Very big benefit. Secondarily, once our product has been approved as an ingredient, and we're able to customize different fractions of our product, then things are done. It's considered an ingredient. So we can just mix and match different ingredients to find a product which is suitable for different disease areas. And we know that inflammation is the root cause of many, many, many types of diseases out there. And if we're able to ameliorate that inflammation by addressing the dysbiosis in patient communities, then we have the potential of really hitting a lot of these leading chronic and metabolic diseases globally. Hence our decision to target type 2 diabetes, affecting probably north of 500 million people today, and people on metformin is about 125 million. So that's a great starting point. But we're not limited to looking only at type 2 diabetes. We want to look at other disease areas as well. And with that, I welcome questions.
Thank you. You can sit down if you like.
I'll sit here.
Wherever you want.
Yep.
Okay. So, first of all, I thought we could talk a little bit about the rights issue, which is, top of mind. So, following the rights issue, what's the timeline look like? What developments can investors expect maybe 12 months following the rights issue?
Yeah, as I said, the priority task right now is to complete the second gen process, and hopefully that will be done within weeks, actually, what we're talking about there. And from there, the completion of the GRAS work. The good thing about our second gen process, I've communicated as well that we'll be coming out with an update, sort of a product roadmap regulation update, which is going to be much more ambitious than what we've communicated previously in terms of multiple products and multiple applications. So you're going to see almost like a pipeline of things happening there. And the intention is quite simple. You know, we said that we want to customize our products. That means we need to get the base product approved. The product varies very little between the different ingredients. If you produce our Carbiotix from pea fiber or oat fiber or corn fiber, it's just a small amendment to the application itself. And we can leverage the existing regulatory process in terms of experts as well. So we can really expedite that process. And once that's done, then obviously we can really ramp up the process of customizing our products for different applications. Probiotics and development of symbiotic products, different studies, the metformin extended study, as well as looking at other disease areas. Yeah, and that's the intention, is to start building up that pipeline with the new constitution of the board.
All right, interesting. Can you share any updates about the progress of the subscription? How's it going? Do you have any indications from investors? A lot of interest?
I have no idea. I don't know where are they in the room? Generally speaking, I hope there's certainly interest based upon what I've communicated today. I'll be there being a top garant, so I'm going in with about, I'm committed to 1.2 million, and I'm committed to 1.3 million. So in total, 2.5 million of the 12 million raise I'll be going in with. And the thing is, I purchased shares from 4 crowns all the way up to 16 crowns. And the current share issue or the subscription price is about 1.88 crowns. So relative to my previous purchases, and I own about 17.5%, so I should get up to roughly 20% of the company after this. This is quite an attractive price for me, at least, to pay. So generally speaking, I hope there's interest. The area is very hot today. Some of the more recent news is some of the first drugs have come through in the microbiome area, which is sort of validating the whole case for using microbiome therapeutics to address different health issues. We're taking a different approach. Instead of trying to develop a drug, we're taking something that's to be used in conjunction or as a co-intervention with a drug to improve the efficacy, and then coming with a companion diagnostic to validate that. So at the end of the day, people are not taking placebos. They're taking a modulator and then validating whether the efficacy is there. So we're really embracing the whole concepts of personalization and transparency, which are sort of macro trends, not only within food, but also in pharma going forward.
All right. To change the subject a bit, in the presentation, you mentioned a partnership that you recently signed. Would you like to elaborate a little bit more about that partnership and what it means for you?
First of all, we respect anonymity. One partnership area that I did mention that is public is with a venture, and this is the group started by Rickard Öster, based in Lund, actually in the same building as us. And there we'll be working on both on the diagnostic collaborative opportunities, but also on the products themselves. With regards to the probiotics company, obviously we have to respect anonymity for competitive reasons. Sure. I don't even need to explain that. And there the intention obviously is to have a project which will extend into 2024. But my firm belief is that symbiotics, the combination of the prebiotics, so the food for your probiotic bacteria, and constructed probiotics, not your own host, serving to form these symbiotics, will be the way of the future. And I think a lot of the products in this space will take the form of a symbiotic, and you can add like postbiotics, which like portions of metabolites as well. So that's, I think, going forward. And I would be very surprised if there's not significant continuity and dealings there. And we had our first kickoff meeting with this particular company, and ideas were flying around in terms of definitely other areas we can go into well beyond the scope of the initial. And again, this is a top 10 probiotics company. The probiotics industry is about a 50 billion euro industry today. And this company represents, about 2 to 3% of that.
All right. And for everyone who's here, the subscription period ends June 2nd, which is on Thursday, this Thursday. Any final things you'd like to add?
Yeah, I hope you found the presentation interesting. I hope you found me somewhat interesting as well. Sorry about presenting in English. Jag kan ta det på svenska också. Det funkar lika bra. Teckningsperioden ska avslutas 2 juni och ni är välkomna att titta på detta. Som sagt, jag representerar ungefär 20% av emissionen också. Så att jag har definitivt ett starkt förtroende i själva bolaget. Och jag tycker det är en spännande fas just nu. Och tid, tack vare att vi har kommit så pass långt, bolaget har varit igång i nästan 9 år. Och nu kommer vi egentligen till den här fasen att vi kommer ut på marknaden med en bra produkt och tjänst som formar den här smart prebiotic-koncept. Så att ni är helst välkomna att teckna aktier i bolaget.
Tack för det.
Tack så mycket.
Tackar.
Tack så mycket. Tackar.
Tackar.
Ja, tackar.